Healthcare before Medicare, early retiree challenges. One of the biggest obstacles facing anyone pursuing financial independence and early retirement is healthcare coverage. The gap between leaving your employer-sponsored health insurance and becoming eligible for Medicare at age 65 can be financially devastating if not properly planned for. Understanding your options and developing a strategy is crucial for a successful early retirement. Let's talk about the Medicare Gap challenge. If you retire early at age 50 or 55, Medicare eligibility doesn't begin until you turn 65. This creates a coverage gap of 10 to 15 years where you're responsible for securing and paying for your own health insurance. During this period, you won't have employer-sponsored coverage, and you're not yet eligible for government health care. This gap represents one of the most significant financial risks in early retirement planning. Healthcare costs during this gap are substantial. The average annual premium per person exceeds $7,000, and that's just for the insurance premium itself. For a couple retiring at age 55, the total cost over a 10-year gap can easily exceed $100,000. This doesn't include deductibles, copays, or out-of-pocket expenses. These costs can significantly impact your retirement budget and must be factored into your financial independence calculations. Fortunately, several coverage options exist to bridge this gap. The four main options are COBRA continuation coverage from your previous employer, ACA Marketplace Plans, also known as Obamacare, coverage through a spouse's employer if they're still working, and health sharing ministries. Each option has distinct advantages and disadvantages in terms of cost, coverage quality, and eligibility requirements. Understanding these options is essential for making an informed decision. Let's examine COBRA coverage first. COBRA allows you to continue your employer-sponsored health plan after leaving your job. The major advantages are that you keep your existing plan with the same doctors and network, and there are no medical questions or pre-existing condition exclusions. However, COBRA has significant drawbacks. It's very expensive because you pay 102% of the full premium without any employer subsidy. Additionally, COBRA coverage is limited to just 18 months, which won't cover the entire gap for most early retirees. ACA Marketplace Plans, established under the Affordable Care Act, offer comprehensive health insurance with several advantages. Premium subsidies are available based on your income, not your assets, which makes them particularly attractive for early retirees. All plans provide comprehensive coverage, including essential health benefits. The disadvantages include limited enrollment periods, typically only during open enrollment or qualifying life events, network restrictions that may require changing doctors, and potentially high deductibles depending on the plan level you choose. The key to maximizing ACA Marketplace benefits is strategic income planning. By controlling your taxable income through careful management of Roth conversions and timing of capital gains, you can lower your modified adjusted gross income, or MAGI. The goal is to target subsidy thresholds between 100 and 400% of the federal poverty level. This requires advanced planning with your retirement withdrawals, but can result in dramatically lower healthcare costs, sometimes reducing premiums to just a few $100s per month. Beyond COBRA and the ACA Marketplace, several alternative options exist. If your spouse is still working, adding yourself as a dependent to their employer coverage can be cost-effective. Health sharing ministries offer lower monthly costs but aren't true insurance and have coverage limitations you must understand. Short-term health plans can serve as temporary bridge coverage but come with limited benefits and pre-existing condition exclusions. For those planning extended international travel, expat coverage might be worth exploring. Successful healthcare planning requires several key considerations. First, research your options thoroughly before retiring, not after you've left your job. Second, budget for healthcare as a major expense in your retirement calculations. Third, compare total costs including premiums, deductibles, and maximum out-of-pocket expenses, not just the monthly premium. Finally, balance your income needs with subsidy eligibility. as earning slightly less in taxable income could result in thousands of dollars in premium savings through ACA subsidies. Let's summarize the key takeaways. First, the healthcare gap between early retirement and Medicare eligibility at age 65 is financially significant and cannot be ignored. Second, multiple coverage options exist, each with different trade-offs in cost, coverage, and flexibility. Third, the ACA Marketplace offers the best value for most early retirees when combined with proper income planning strategies. Fourth, healthcare should be budgeted as a major retirement expense, potentially costing $6,000 to $10,000 or more per person annually. Finally, start planning your coverage strategy before leaving employment to ensure seamless transition and optimal cost management.
If you like this video, hit that like button and don't forget to subscribe. Visit CodeLucky.com for more such useful content.